Hello and welcome to the Community Voice. I'm Fara. I'm privileged to have as my guest today Dr. Stacy Nassau. She is a board-certified allergist and immunologist with Florida Center for Allergy and Asthma Care, treating adults and children with 19 locations in the Tri-County area in Miami-Dade, Broward, and Palm Beach. And I love your slogan, breathe easy once again.
It's a good one.
Absolutely, and that's what it's all about.
Yes.
So this is I want to welcome you.
Thank you.
And this is not your
for
first
having me.
and it's not your first rodeo with me.
No, I've been here once before.
So you know what we're going to talk. We're
Yes.
going to talk about politics and religion, right?
Oh yes, definitely. My favorite topics.
No, we're going to talk today. It's going to be an interesting because we have from our audience they've sent in questions from our
great.
different locations. So let's just get right to it.
Sounds good.
Okay. Tom asks me, can you explain in simple terms how allergies work and why some people have them while others don't?
Sure. So allergies are an overreaction to generally benign proteins in the environment, in foods. In general, the people that are going to develop allergies are those that have a genetic predisposition. So if your parents, either one or both, have allergies, then a child is much more likely to develop allergies. That doesn't mean it's 100% that they will, but the tendency is more likely there. So, that may manifest in terms of allergic rhinitis, which is hay fever, the sneezing, itchy eyes and nose symptoms. It could be food allergy, it could be asthma, it could be eczema. So those all kind of come together on the same set of genes. So if you have those genes, you're more likely to develop one or more of those diseases.
And is allergies and sinus problems, are they going to go hand in hand?
Oftentimes they do, sometimes not. So sinus issues can come from anatomical abnormalities, or it can be, behind allergic inflammation. If you have baseline inflammation in the nose and the sinuses, that will predispose you to bacterial infections more often than somebody that doesn't have that.
We have another question here from Emma from Aventura.
Okay.
Thank you, Emma. My baby's blood work shows that he's allergic to everything.
Yes.
Can this be possible? First, let's get into the
Yes.
testing and how that happens
Yes.
and what that means.
That is an excellent question, actually, Emma. So thank you for asking. So a lot of babies will come to us in the allergist office with a whole slew of tests, blood work, that shows that they're positive to everything. So, the most classic story is that a kid will have eczema, dry, red, patchy, irritated skin. They go to the pediatrician, they're inquiring about food allergies that may be, contributing to the eczema, which is a reasonable question, but they may have a blood panel done with tons of foods. Now, food allergy testing is a little bit tricky, which is really why it's the best idea to see a pediatric allergist to help you kind of decipher. There's no one test that will say yes or no, you have a food allergy. So when we're trying to discern if someone has a food allergy, we'll do blood work, we'll do skin testing, and we'll use both of those together to determine if that child likely has an allergy. Okay, so when babies get blood work and they have eczema, there is a very high risk for false positives. So a baby may eat eggs every day, right? Let's say there's a 9-month-old and really loves eggs. Terrible eczema, blood work shows that the egg allergy is there. If the baby eats eggs and doesn't have immediate hives or swelling or vomiting within minutes of eating it, it's not likely that they have a true egg allergy. So a lot of parents come in very distressed. Looks like their baby is allergic to everything. What can they feed their baby? I mean, it's important for children to have a variety of foods so they can grow and be exposed to a lot of different nutrients, and they don't know what to do. So they bring us their testing. We have to kind of tease it apart a little bit with skin testing and use that blood work that they already have. And that helps us to guide parents and get kids to eat more things.
Is the protocol still the elimination diet? Like if I eliminate eggs, if I eliminate wheat, if I eliminate corn and gone and on. And so do you do it that kind of tweaking?
So sometimes you can, but it gets a little bit dicey if you have a child with bad eczema, because those kids going back to the genes, right? So they have those genes that sort of predispose them to allergies. Eczema is an allergic condition. If you have eczema and you start avoiding foods, then you may become allergic to them. The more that you introduce something, and actually, this is kind of an interesting thought. In the last couple of years, we've really recommended peanut introduction for infants 4 to 6 months of age that have eczema to prevent allergies. So the more that you're seeing a protein and you're eating it, you're less likely to be allergic.
That was one of the questions that came up. Should we avoid, when do you introduce peanuts? And the pediatrician at that point said, with the Bamba, this wonderful, like crunchy,
Peanutty
delicious. I even love it.
snack.
I mean, it's like
I like it too.
I'm guilty. I am guilty.
It's a good one.
Yeah.
It's a fun one. My kids love it. So
what's the feeling about, peanuts? Because you're hearing a lot about don't bring peanut butter to school, don't pack it for your kids' lunch.
Correct. So I see where that comes from. If children in general don't really understand as much when they're preschoolers, don't take Johnny's food because perhaps it has peanuts in it. So a lot of preschools and elementary schools are banning peanuts and tree nuts for that reason.
Is it an overreaction?
I don't think so. I think, it's a scary prospect that your child is going to a school that, maybe the other children or the staff may not be familiar with food allergies as much as the parent is. So now to ban every single food, because there's potential for allergy is a bit much, but peanut and tree nut, I think most people can get around that with other food options at school. But
you're saying, to introduce it early, can you introduce it like with a Bamba based? I feel like I'm promoting, and for you and your grandchildren and your children, eat Bamba.
Bamba's a good one. So actually, for infants, they don't really have the motor skills to eat Bamba. So what you might do is you can take Bamba and wet it with water and kind of make a slurry, like a peanut slurry out of it, and give that to the child.
So that's the belief now, is to introduce it early. At what age?
Yes. So if somebody has eczema, then 4 to 6 months is really the desired time. If they don't, there's less of a push to do it so early. You can do it whenever the parent feels comfortable. But truthfully, if you have moderate to severe eczema, the earlier, meaning 4 to 6 months that you do it, the better the outcome for a child. So.
And it seems like for children, it's eczema showing its ugly, rearing its head as a reaction, allergic reaction.
Yes.
But does that happen with adults too?
Yes. Oh, yes. And actually, you can develop eczema as an adult. So a lot of patients will come in their 30s and 40s and say, well, I never had eczema as a child, so I don't really know what's going on with my skin now. It can develop at any age.
So eczema is itchy?
Yes, it's very itchy, very
scaly
itchy,
looking?
Scaly, red. Different ages, it can present at different areas of the body. So, the younger kids, like the infants, may have it on their torso, their abdomen. A little bit older children in the area in front of the elbows or behind the knees. Adults can really have it anywhere. So, but it can come at any age, and it's chronic. So there's nothing we can do to completely make it disappear, but we can manage it and make it more comfortable.
And so when you have the eczema component, is the allergy going to present itself in another way? Is the asthma going to be there? It seems like there's like this cyclical wheel that continually goes around and around until you break the merry-go-round.
So it's actually kind of interesting. So we talk about the atopic march, which means that in general, eczema is going to develop first. So when you have, a baby or a child that you're thinking of, eczema is going to be the first allergic chronic condition that's going to show up. Then we might see food allergies, okay? Then we might see asthma, and then we might see allergic rhinitis. So what I mean by allergic rhinitis is the nasal, sneezing and runny nose, and perhaps the eye symptoms too. But they tend to develop in that order.
Oh, interesting. So we have another question here. Bobby from Kendall. My child is asthmatic and cannot do PE in school or play sports. Is that true?
No.
Bobby,
yes.
Why limit your kid?
Indeed. So exercising and physical activity is actually very helpful, for asthma and for our health in general. So it increases endurance, it increases the strength of our lungs. So a lot of times asthma will present in children as difficulty breathing, coughing, wheezing with running and activity. So, a lot of parents and children think, okay, well, that doesn't make me feel good, so I'm just going to not do that so I don't feel that way. And that's a reasonable thought. However, if you're feeling that way, then you should come see us so we can give you the appropriate medicines and the appropriate treatment so that you can do those things.
And it seems like there's a prophylactic. You have to do it in advance before
Yes.
things really get out of control. And I'm sure you're seeing that in your practice before the difficulty, because it's not like a one-time thing and it goes away. It starts cyclically getting worse.
Yeah, well, so it's another chronic condition, just like eczema and food allergies can be. If you have mild asthma, most people can just take albuterol or a kind of a rescue inhaler actually prior to activity, so maybe 30 minutes to an hour before you're running around, that will prevent you from feeling that way during activity. If you have symptoms not related with exercise, you're coughing at night, you're wheezing, can't breathe so well, then we're more likely to put you on a daily preventative inhaler. So those need to be taken daily to decrease inflammation that's in the lungs. And so that when you're exercising or being active, your lungs are less likely to respond and become tight when you're doing those things.
I know that there's a cough involved with asthma. There's I can't breathe, I can't get it in, can't breathe out.
Yes.
What is going on in the body? How is it reacting? Why is it doing that during an asthma attack?
Sure, that's actually a really good question. And it's also a little bit complicated. So
I like to ask complicated
I
questions.
like it, and I love
so
to
you can
answer them.
handle it.
Thank you. I try. But I actually really enjoy describing this because I think, if a patient understands what's going on in their body, then they're much more likely to take the medicines and to feel better. If you, just kind of throw medicines at someone and say, this is the way to be, it doesn't really, speak to anyone, right? And it's hard to follow along if you're not really sure why you're doing it. So I like to explain that the lungs are like an upside down tree. Okay, so the trunk is the bronchus, and then it kind of branches out into progressively smaller airways. So in asthma, most people are affected in the small airways at the very end, the little twigs at the end of the tree. Okay, now there are muscles that line the airway, and there is stuff clogging the middle of it. So there's white blood cells, there's mucus, and obviously those two things can decrease the diameter of the airway. So when you're trying to get air in and out, especially if you're exercising and you need that air to come in and out faster, right? You have trouble moving the air, okay? So we have to address that in two different ways. To address the inflammation, which is the mucus and the white blood cells in there, that's what those daily medicines are for. And that's why you have to take it on a daily basis. Because if you take it just kind of as needed, the inflammation is always gonna be there. Okay. Now, why do people have inflammation? Sometimes it's from allergies. So for example, cat allergies or dog allergies, if somebody has a pet that they're allergic to, they breathe in those allergens, and they can cause that inflammation in the lung. Or dust allergy, that's a really common one. Sometimes it's weather. Some people feel much tighter in the cold air. And sometimes it's non-allergic asthma. So not everybody that has asthma has an allergic type of asthma.
What does that mean?
So, some people have allergies that will trigger their asthma. Other people have different types of asthma with actually different types of cells that are causing the inflammation. And they're not really allergic. So there's actually a very big, wide spectrum for asthmatic patients.
But it really doesn't matter where it's stemming from. It's still the result is I can't breathe.
Correct.
I'm having asthmatic symptoms.
Yes, exactly. So at the end of the day, the feelings are generally the same. You feel like you can't breathe, you're coughing, you're wheezing. But back to the lungs, the muscle that lines the lungs, the reason we use albuterol or a quick-acting medicine is it relaxes that muscle. So it kind of tenses up like this. The medicine will cause it to sort of come open a little bit. So we need both of those to effectively treat asthma.
So when you're treating children, it's the same as it would be for adults, but a different dosage.
Yeah, different doses.
And how do you get them to take the medicine?
So that's a really good question.
You comply. Do you give them that bumba that we talked about earlier?
Then they may be more prone and more interested in doing it. I like that idea. No, so the parents really have to get involved, right? So, a child often doesn't really understand the long-term consequences of this. So, if you tell an 8-year-old, go take your asthma medicine, maybe they will, maybe they won't. So the parent really needs to sort of supervise. Most asthma medicines are twice a day. So you'll do it in the morning and you'll do it again at nighttime. So I usually recommend doing it with teeth brushing because you want to really rinse out your mouth after you're doing the asthma medicine anyways. So if you put it next to your toothbrush and, the parent is potentially supervising brushing teeth anyways, then it's very easy to
Becomes
get that.
routine. They're thinking that that's part of their routine.
That's right. That's right. You're not going to forget to brush your teeth, and you're not going to forget your asthma medicine. At least I hope not.
Absolutely. We have another question.
Yes.
Lydia from Hialeah. Okay. My daughter is allergic to cats, but my grandmother told me keep the cat, and the more she plays with the animal, the less she will react. Is it okay to have a pet, even though the testing shows that they are allergic to pets?
That's a really good question, and one I see in my clinic pretty much every day.
That's why my kids got goldfish.
That's why I got goldfish when I was a child, because I was allergic to cats. So cats and dogs and rabbits and other animals can be very common allergens. There are proteins called dander that are found in these animals. And unfortunately, there's no such thing as a hypoallergenic cat or dog.
Why is it that they always are trying to sell us on that,
It's a good question, and I think you hit the nail on the head with the word sell. So you can, from what I understand, you could probably make more from selling that type of an animal. But in general, all cats have a protein called FeLD1, and that's the most allergenic protein in a cat. So certainly different cats have different levels that they secrete of this protein, but it's found in the skin, it's found in the urine, it's found in saliva. So a lot of people say, well, my cat doesn't really shed, so they're hypoallergenic. There's the protein found in other places as well. So every cat has the potential to give somebody allergies. So in general, when we have somebody that is allergic to a cat, there's really three ways that we can go about treating that person. Okay, so first is we try to reduce exposure. So
don't go to the pet store.
Don't go to the pet store.
Or the shelter to think about getting.
Don't even look at them because they're so cute.
Animal.
So don't tempt yourself.
Stay home.
Exactly. Stay home and get goldfish because goldfish are safe. But if you already have a cat, because a lot of patients will have the cat sort of preceding their allergy. Or,
yeah, but does the allergy happen because they've had the cat?
It can. Again, it kind of goes back to the genetic predisposition. Like some people develop it after they've had a cat. Some have already had the allergy, but it was perhaps milder. Now that they have the daily exposure, it's really kind of rearing its ugly head. But so first we want to reduce exposure if possible. So if you have a cat that's in the house, a couple of things can be helpful. So washing the cat, which I know cats don't really like water.
Is that do they go hand in hand?
Not so much. but washing the cat, if they're amenable, about once a week can kind of help decrease those levels. Using air purifiers like a HEPA air filter can be helpful. Keeping the cat out of the bedroom. So if you can create your bedroom as a space that's not dander free, but less dander than the rest of the house.
So if you had hard floors versus carpet.
So much better because it's so much easier to clean. And actually cat dander is extremely sticky. So let's say you had a house with a cat and the cat goes away. It can take up to 9 months to have no detectable cat dander. So it really is, it's hard to manage, right? So to a certain extent, we try to decrease exposure. Now, number two is we try to give medicines that can be helpful, right? We're talking antihistamines, nasal sprays, these kind of things, but often they have to be used on a daily basis, which some people don't mind. They would rather take that than get rid of their cat. And I get it, that's fine. But the only thing that we can offer that will actually change the way that somebody is responding to a cat is to do something called allergen desensitization. So, colloquially, we call them allergy shots. So what is that and why would somebody do that? It's a long-term process where we desensitize somebody to whatever their allergy is. So it doesn't have to just be cat. It can be dust, it can be dog, it can be pollen, it can be mold. But what we're doing is we're introducing these allergens to your body in a controlled manner.
So this is good for children as well as adults at the practice.
Yes.
And you do all of these services at Florida Center for Allergy and Asthma.
We do.
19 locations. That's a lot of places that you could go to really conveniently. You've been in business. You've had the practice for a long time, since the early mid-70s.
Correct. So
I remember Dr. Michael Passon and Joan Gluck.
Yes.
Yeah. So the practice has really evolved in treating so many different facets of allergy, asthma, immunology. I'm sorry. I just wanted to get that plug.
I love it,
you guys.
That was excellent. But yes, we've been doing this for a long time, and we really feel passionate about helping people to be able to conquer these allergies, because they can really be, bothersome to the quality of life. We love our animals, we love our cats and dogs. I don't like to give the answer, get rid of your animal, because I think that's unfair. There are a lot of other things that we can do to make having them much more comfortable.
Absolutely. That's perfect. Well, we did the peanut allergy, because that was the next question. Next question is from Palmetto Bay.
Okay.
Dolores. My mouth itches when I eat an apple, but I love apple pie. Me too. Also, the same thing happens with eggplant. Can I enjoy eggplant as well?
I love that question, because I think it's so interesting, and people love to hear this, because the body really works in mysterious ways sometimes. So this is something we call oral allergy syndrome. All right. So if somebody ever tells you, my mouth gets itchy with apples, raw apples, okay, apples, carrots, plums, perhaps eggplant, but the cooked version is okay, like apple pie, they most likely have oral allergy syndrome. And what that is somebody's allergic to actually a pollen, like a tree pollen or a grass pollen. The apple one is birch pollen. Okay, so the birch tree has pollen, and very allergenic. So a lot of people are allergic to it. If they're allergic to that, sometimes they get this oral allergy syndrome. So the birch pollen and the apple proteins look pretty similar. So when you're eating it, your body thinks that, maybe you're eating
a tree.
A tree. Delicious. So then you'll get
bark and all.
Exactly. You'll get that, itchy feeling in your mouth. In general, it does not cause anaphylaxis. So most people that
anaphylaxis
have this,
is when there's a constriction that you can't
it
breathe.
It can involve that, yes. So, swelling of the lips, the tongue, the throat, hives all over. So kind of more the classic food allergy that we think of, like the peanut allergy.
And then you think, and what came to mind was bees.
Yes, you can get anaphylaxis to bees as well. And different stinging insects, wasps, fire ants, actually, they can all cause that as well. But this does not generally cause that. So if you wanted to eat apple pie or any type of these fruits that are baked, or vegetables that are baked at a high degree for a certain amount of time, the proteins actually kind of unwind in the heat. So they become less allergenic, and they don't look so much like the original protein. So that's why people are able to tolerate that.
And that's very interesting. Getting back to what you were talking about, food allergy is very hard to detect, because it's what you were just saying. It's not in its natural form, but you've morphed it into cooking. So it changes again the chemicals and the way the body reacts.
That's right.
Whew, what I am learning today. We have Todd. Thank you, Todd, and he's from Aventura as well.
Okay.
Why should I see an allergist if I think I have asthma?
So kind of what we were talking about before, if you don't treat asthma, it can be very symptomatic, right? You have this chronic inflammation in your lungs. You can't breathe well, you're not sleeping well at night. A lot of asthmatics really have more difficulty at nighttime. They'll be coughing and, even perhaps waking up their partner, or if the child has another, sibling in the room. So multiple people are not sleeping here. And the fix, we can offer a lot of really wonderful medicines. And actually in the last 10 years, if you have severe asthma, we even have injectable medicines that can be helpful. So there really is a whole range of different options that we have, and there's no need to suffer in that way. So I would definitely see an allergist if there was even a concern that somebody might have asthma.
Oh, that's great. Coming from Weston, are food allergies on the rise with gluten-free, egg-free, peanut-free, or has it always been?
So food allergies are definitely on the rise. And the reason for that is a little bit unclear. So it may be, partially due to this, where we're avoiding certain things, right, from a young age, because, as I had mentioned earlier, if you're not eating something for a while, your body kind of has a chance to develop an allergy to it. If you're continuously exposing yourself, you're unlikely to develop an allergy to that. So that may be part of the issue. The other thought is that our society is a lot more clean than it has been in the past. So a lot of children that have grown up on farms or in more rural areas actually have much less prevalence of having allergies and asthma. And the thought is that, they were exposed to a lot of bacteria and viruses and fecal matter, during their childhood, and it's somehow impacted their immune system in such a way that they just didn't create these allergies and asthma. So, it's not the end of the world if a bomba falls on the floor and your child picks it up to eat it.
Yeah, I remember that there's like a 3-second rule. If it lay on the pacifier, especially.
Indeed.
So is this, we're talking about gut health here? Is this part of what we're talking about, and how allergies are affected by the gut? Maybe we can talk. It's not a question. That's just a me question with you question.
So this is a fascinating topic, and there's a lot of research that's actually ongoing right now about the microbiota in the gut, the different bacteria that live there, the good bacteria, the bad bacteria, how they kind of balance each other out, the overuse of antibiotics. So a lot of people take antibiotics for things that are not bacterial infections, and you actually wipe out a lot of the good bacteria that's in our body. So there's a lot of research. There's nothing really definitive at this point or anything that we can act upon. But I think the understanding is that there is a relationship between the gut flora and allergies. So we're trying to discern that at this point.
So I should go live on a farm, bring my grandkids, and everybody we just put on overalls and just shovel in the manure.
That sounds great. Yes, go hang out on the hay.
Absolutely.
There's a lot of mold in hay.
That's not so good then.
Well, again, mold, and you can be allergic to mold or you cannot be allergic to mold, right? Excessive amounts of mold is probably not great, but not everybody has a mold allergy.
Are you on a probiotic thoughts for helping the gut health, to help sinuses, to help allergies?
Sure.
So I'm not trying to tie it. I'm trying to see if there is a tie, though.
It's an interesting question. I personally don't. I mean, I eat yogurt, so that's where I get my probiotics. But
not as a supplement.
No, I think some people like to do that, and they feel better when they do that. But most supplements are not FDA approved or stringently examined. So it's kind of hard to know like how much you should be getting, which ones you should be getting, how often do you take them. So there really hasn't been so much data in regards to that. But I think it's something that we should look further into.
Absolutely.
Sure.
Absolutely. Yeah. We have another question here. I was told that I'm allergic to dust mites. This is from Hollywood. Okay. How do I control the home environment to mitigate the problem? Tell me about where dust mites are living and
everywhere. It is very lovely. So that's actually a really wonderful question, and one that I answer multiple times a day. So dust mites are the most common allergy that I see. So if somebody has allergic rhinitis, and we do the skin testing to the environmental panel that we have, most often, if there is something, it will include dust mite. So dust mites are actually insects. They are microscopic, and they live in fabric a lot of times. So they're in mattresses, they're in pillows, they're in carpets, they're in curtains. So they're just part of our environment. So a lot of people will say, oh my, like I better go buy a new mattress.
No, we should just live on the farm outside with the cows.
In the hay. Rolling with the cows, yes. No, but I wouldn't buy a new mattress because then they're going to come, populate that mattress.
So what do we do to mitigate?
Great question. So for mattresses, I would buy a mattress cover and a pillow cover. So what you're really trying to do is you're encasing these things that have the dust mites within. You're going to zip them closed so they can't come out, and they're knit tightly so that they can't kind of come through and affect the person that's lying on the mattress, okay? Now, washing the sheets in hot water on a weekly basis, vacuuming, air filters, the HEPA air filters, if possible, having carpets removed with and putting in hardwood floors or tile floors. It's much easier to clean. Some people will say to me, well, my house is very clean. I don't have any dust mites. you still do, okay? They just may not be as numerous as somebody else, but everybody has dust mites in their environment. So it's hard to completely, or it's difficult, it's impossible to completely get rid of them, but we can certainly reduce the levels that one is exposed to.
So it made me think about pediatrics, stuffed animals.
Yes, so there are a lot
They love their little teddy bears. Can you throw
know.
that in the washing machine, dryer? Is that how we get rid of? How do you get rid of things that are in your pillows or in your kids' toys?
You can actually wash your pillows. A lot of people don't really think about that or do that, but you can wash your pillows. Stuffed animals do contain a lot of dust mites. So, some kids love to have 50 stuffed animals in bed with them. I recommend maybe picking one or two favorites and kind of keeping it to that, and then you can wash them, every so often to keep those levels down. But having 50 is just it's a bit much.
It is. I would say I sleep with 49 of them. So yeah,
you're getting there.
This has really been so insightful. I have another 30 questions. We could probably go on for another 30 minutes, but I'm going to have you back.
Okay,
Dr. Stacy Nassau.
I would love to come back. This is so fun.
And we are blessed to have you here with great information. And for more information, you can go to their website at florida-allergy.com to find out more. They have many locations throughout the Tri-County area in Miami-Dade, Broward, Palm Beach, and you get to meet doctors in the practice that have great knowledge, that are there for your family, for yourself, for your kids. And I want to thank you for this time.
My pleasure. It was very fun. Thank you for having me.
And I want to thank you for joining me and Dr. Nassau on the Community Voice. Until next time, take care of yourselves and each other.